Hi, my name is Dr. Salahuddin Abubakar, your friendly neighborhood dentist at Pearl Dental Clinic in Business Bay. We are actually opening up this new segment, that is Ask Your Dentist. And the reason is, like, we get lots of questions, lot of inquiries, and my team has asked me to make a video series on the same. So if you have not subscribed yet, please subscribe to this channel, and if you find this useful, please do share. If you have some questions, please do ask us in the comments section, and we will be happy to answer each and every one of them as much as possible, right? So let's dive in. So the question for the day is, at what age should my child get braces? Now, this is one of the most asked questions, even directly whenever we have patients walking into my practice. They ask me this question as to what would be the ideal age to start the braces. Now, there are few certain conditions that we look into. One is the growth of the child, the growth of the teeth, the overall completion of his the transition, I should say, the transition from his milk tooth to an adult teeth. So once that has been accomplished, we would sometimes take an X-ray to assess the completion of the growth, and if it is satisfactory, then we are ready to go. Ideally, it's an age between 12 to 14. The earlier the treatment starts, the likely that the treatment becomes more successful because the tooth movements are more easy to achieve in a child or in a teen. Now, there are certain times that we may have to intervene before. That could be an age between 8 to 10. We do sometimes pre-orthodontic assessment to make sure that everything is in order. If not, do we have to intervene? Do we have to provide them with preventive appliances to stop the movement or to redirect the teeth in a different way, so that as the time comes, the orthodontic treatment becomes much more easy. The stage actually starts from the age of 6 onwards to assess if they have any habits. So if they have habits such as lip biting, thumb sucking and all this, we will have to make sure that we get them out of these habits as soon as possible, either through counseling or by providing them with habit breaking appliances. So this is at the age of 6 onwards. Why is the age of 6? Because it's the first milk tooth that falls off and the permanent teeth starts erupting. There can be minor variations. It could be slightly before 5, or it could be slightly after 6. So it's definitely not. So if the child is on a regular visit to his or her dentist, the dentist will be asking them special questions to identify if this child has any specific habits that needs to be blocked. Then is at the age of 8. That's when most of his or her the front teeth has developed pretty well, and his molars are also developed very well. So if this is the case, but then there's some space management issues, or the jaw has not developed enough with the speed at which the permanent teeth are erupting, in these kind of cases too, we may have to intervene, and we give them space braces, so that we expand, or we call them expansion appliances. So we apply them on the tooth surface, and that will help the arch widen a bit, and giving more room for the teeth to align. So there are these are pre-orthodontic screening age, and this will set the ground for the actual braces. So when the time comes for the actual braces, things becomes a lot more easier, shorter, faster. So I hope I have answered this question, and please rate us again if you like this video, and hope to come back to you soon with another question. Thank you for watching.